What is the significance of the blood-placenta barrier in toxicant distribution? The blood-placenta barrier regulates what substances reach the developing fetus. While it offers protection against many hydrophilic toxins, lipophilic and small molecules can often cross easily. For instance, corticosteroids or organophosphates can pass through, potentially causing developmental defects or abortions. In livestock, toxic exposure during gestation can lead to abortion storms or congenital anomalies, underscoring the importance of screening feed and drugs during pregnancy. What are tissue reservoirs and how do they influence toxicity? Tissue reservoirs are body compartments where toxicants accumulate, often leading to delayed or prolonged effects. Fat stores lipophilic substances, for example, DDT, dioxins. Bones accumulate heavy metals like lead and strontium, and melanin-rich tissues may retain aminoglycosides. These depots can later release toxicants back into circulation during stress, starvation, or illness. This is why animals might show symptoms even after the exposure source is removed. What is meant by enterohepatic circulation in toxicokinetics? Enterohepatic circulation occurs when a toxicant excreted in bile is reabsorbed from the intestines, prolonging its presence in the body. For example, in dogs, NSAIDs like carprofen undergo this recycling, increasing their half-life. This process can lead to toxicity even at normal doses. It also affects how long detoxification needs to continue. Activated charcoal, repeated at intervals, can interrupt this cycle by binding resecreted toxins in the gut. How do active transporters affect toxicant movement? Active transporters are proteins that move toxicants across cell membranes, sometimes against concentration gradients. For instance, P-glycoprotein actively pumps drugs out of the brain, protecting the CNS. Dogs with MDR1 gene mutations, especially collies, lack functional P-glycoprotein, allowing ivermectin to accumulate in the brain, causing neurotoxicity. Understanding transporter roles helps predict drug interactions, species-specific risks, and CNS toxicity potential. Why is biotransformation capacity different across species? Enzymatic profiles vary across species, influencing how they detoxify compounds. For example, cats have limited glucuronidation, making drugs like acetaminophen deadly. Birds have underdeveloped CYP450 enzymes, so they're sensitive to many insecticides. Fish rely heavily on gill and skin metabolism. These differences explain why goats can tolerate some anthelmintics at higher doses, while horses or dogs may not. This is vital when extrapolating drug doses between species. What is meant by metabolic saturation and how does it affect kinetics? Metabolic saturation happens when enzymes responsible for detoxifying a compound become overwhelmed. At this point, the toxicant no longer follows first-order, proportional, kinetics but switches to zero-order, fixed-rate, kinetics. For example, the metabolism of ethylene glycol saturates in poisoning cases, leading to toxic metabolites building up, causing acute renal failure in dogs. When saturation occurs, even small dose increases can lead to disproportionately severe effects. How does hepatic first-pass metabolism impact bioavailability? Hepatic first-pass metabolism refers to the liver's role in detoxifying a substance before it reaches systemic circulation. For instance, when ivermectin is given orally, a significant amount is metabolized during the first liver pass, reducing its bioavailability. In contrast, the same dose injected subcutaneously bypasses this effect, making it more potent. This concept is crucial in designing safe dosing regimens and understanding why different routes produce different effects. What are the implications of renal excretion in toxicology? Renal, kidney, excretion clears many water-soluble toxins. If renal function is compromised, clearance slows, increasing toxicity risk. Aminoglycoside antibiotics like gentamicin are cleared renally and can accumulate, causing nephrotoxicity. In poisoned animals, maintaining hydration and promoting diuresis, for example, with IV fluids or diuretics, supports renal clearance. Urine pH can also be adjusted to promote excretion of weak acids, for example, aspirin, or bases. What is the significance of liver enzyme induction or inhibition? Liver enzymes, for example, CYP450S, can be induced, upregulated, or inhibited by certain substances, altering how other toxins are processed. Phenobarbital induces liver enzymes, speeding up metabolism of other drugs, possibly reducing their efficacy. On the other hand, Chloramphenicol inhibits CYP450, slowing detoxification and risking accumulation. In multi-drug therapy or poisoning, such interactions can lead to unexpected toxicity or therapeutic failure. What is a physiologically based toxicokinetic (PBTK) model used for in-food safety? PBTK models simulate how toxicants distribute and clear from edible tissues, helping establish safe withdrawal periods. For example, in swine treated with sulfamethazine, a PBTK model predicted when drug residues in liver and muscle would fall below legal limits. This ensures meat is safe for consumption. Such models account for species differences, drug metabolism, and organ-specific kinetics, making them essential tools in regulatory toxicology and residue monitoring.